this weekly COVID-19 update. My name is Dr. Agnes Mahomva, the Chief Coordinator for the National Response to COVID-19 pandemic here in Zimbabwe. Today I have Mr. Noble Mahomva supporting us on sign language. As of 29 October 2020, Zimbabwe had recorded a total of 8,349 PCR confirmed COVID-19 cases since the epidemic started, including 7,864 recoveries and 242 deaths. The highest number of confirmed cases has been recorded in Harare Metropolitan Province, with a total of 3,327 cases and 121 deaths, followed by Bulawayo Metropolitan Province with 1,644 cases and 109 deaths. 2 weeks ago, I talked about an intra-action review that the nation was conducting. The review aimed to document achievements, challenges, lessons learned that would in turn guide the development of plans for the next phase of our national response. Preliminary results indicate that good progress has been made in capacitating the health system to respond to COVID-19. But that more work needs to be done to strengthen that response. The review specifically reported that all our provinces had identified health facilities for isolation and treatment, and that screening for COVID-19 cases at all public health facilities was taking place very well. 63% of the provinces had a written referral system for COVID-19 cases. Remember, not every health facility is able to manage severe cases that need ICU, and hence the need for referral. 86% of all provinces had strengthened the capacity of their community healthcare workers, such as village healthcare workers, in home-based care. This is very much in line with the fact that majority of the reported cases are mild to moderate, and they do not need to be admitted to hospital, but instead require isolation and management at home in their communities, and hence the need to make sure that community healthcare workers are capacitated. 86% of our provinces had a plan in place for continued delivery of other essential health services. Once again, if you remember, we were focusing quite a lot on COVID-19, and there was concern that maybe other health services were being compromised. It's good to note that they were not. All provinces were working well with key community leaders in dissemination of COVID-19 messages. 63% of our provinces were implementing activities that targeted the most vulnerable groups. They also targeted the youth and the adolescents. Finally, a number of challenges were also identified during this intra-action review. Limited testing capacities was one of the main challenges that the review identified. The review reported that the testing challenge had a negative impact on case investigation and contact tracing, as well as reporting those confirmed cases. So these preliminary results, together with findings from recent modeling analysis by the National COVID-19 team of experts, indicate that the epidemic is being brought under control, but that more needs to be done to make sure that the national response remains on track. The good news is that a lot of work is already in progress. Teams on the ground are putting in place detailed plans to address the identified gaps and challenges in order to strengthen the response and prepare for a potential surge in cases. So what else is new that you need to know this week? This week, Cabinet resolved that opening of border post be phased starting on 1 December 2020, and that curfew hours be revised. Details on this are being worked out, guided by some of the intra-action review findings, and will of course be clearly gazetted soon. So listen once again to these updates. In the meantime though, the phased reopening of schools has continued. Teams on the ground making sure that COVID-19 preventative measures are in place so that learners and teachers go back to a safer school environment. Lessons learned from the first phase of reopening of schools that focused on exam classes for grade 7, Form 4, Form 6 have been used to inform the second phase of reopening of schools, and this time it commenced on the 26th of October for grade 6, Form 3 and Form 5. Government, through Ministry of Primary and Secondary Education, working with another government ministry, Ministry of Health and Childcare, their officials, continue to monitor the preparedness of schools with a focus on making sure that all COVID-19 preventative measures are in place and being adhered to. In addition to the phased reopening of schools, remote learning opportunities for school children have also been put in place. The Ministry of Primary and Secondary Education has produced and is broadcasting radio lessons for primary school children. Almost 800 lessons have now been broadcast with support from partners such as UNICEF. These lessons are for all primary grades. They also cover all subjects. Radio lessons for secondary education learners are also now being broadcast. So, if you are a learner or a teacher for that matter, and you suspect you have COVID-19 disease, or you have been diagnosed with COVID-19, stay at home away from other learners or school children in order to stop the spread of this virus in schools. Take advantage of the radio lessons and other remote learning opportunities to continue learning whilst recovering in isolation at home. If you're isolating at home and your symptoms get worse, you must present yourself to COVID-19 health facility early in order to avoid complications, serious complications. You must also eat healthy meals, drink lots of water to remain hydrated, and of course, as we always say, wear a face mask and ensure that it covers both your nose and mouth to prevent the spread of the virus to others. Clean your hands as often as possible with soap and running water or with a hand sanitizer. Finally, call or SMS the Ministry of Health and Childcare on the 2019 free hotline for additional health specific guidance on COVID-19. You can also call the 2023 free hotline or message the hi to the WhatsApp information hub on 263 714 734 593 for other general COVID-19 information that you might actually need. Once again, do continue to adhere to all the recommended COVID-19 preventative measures and do tune in to ZTV or other media platforms, including radio, to hear this weekly update on the latest COVID-19 information in Zimbabwe. Thank you.